This quick skills video is designed to demonstrate the insertion steps for the Impella 2.5 or Impella CP with the automated Impella controller. This presentation does not replace the instructions for use manual. Once the setup procedure has been completed for the Impella 2.5 or Impella CP catheters, please use the following steps to insert the Impella catheter. Obtain femoral access. Insert the 035 super stiff guide wire provided in the kit. Remove the needle. Insert a 6 to 8 French sheath into the vessel. Remove the 6 to 8 French sheath, then insert a 10 French dilator. Remove the 10 French dilator and insert the 13 French peel-away sheath. Note, if using the Impella CP, insert the 14 French peel-away sheath. Administer an anticoagulant to achieve an ACT of 250 seconds or greater. Once the desired ACT is reached, remove the 13 French or 14 French dilator. Insert a 4 or 5 French diagnostic pigtail catheter with a standard 035J guide wire into the 13 French sheath. Then, advance the diagnostic catheter and guide wire into the ventricle. Remove the 035 standard J guide wire, leaving the diagnostic catheter in the left ventricle. Form a curve or bend on the end of the 018 guide wire, and then insert it through the diagnostic catheter. Advance the placement guide wire into the left ventricle to the apex. Remove the diagnostic catheter. Insert the end of the placement guide wire into the red Easy Guide lumen at the tip of the pigtail. Advance the guide wire until it exits the red Easy Guide lumen near the label. Remove the Easy Guide lumen by gently pulling the label along the length of the Impella catheter. Advance the Impella catheter through the hemostatic valve into the femoral artery and across the aortic valve using a fixed wire technique. Follow the catheter under fluoroscopy as it is advanced across the aortic valve. Position the inlet area of the catheter approximately 3.5 centimeters below the aortic valve annulus and in the midventricle chamber, free from the mitral valve chordae. Be careful not to coil the guide wire in the left ventricle. Confirm position with fluoroscopy and confirm that an aortic waveform is displayed on the Impella console. Remove the placement guide wire. To prevent device failure, do not start the Impella catheter until the guide wire has been removed. Press the Flow Control soft key and select Auto to initiate support. Wait 30 seconds for flow to reach its maximum value. Then, confirm correct and stable placement. Remove any excess slack and confirm position with fluoroscopy and the placement screen. After insertion of the catheter and until explants, ACT should be maintained at 160 to 180 seconds. Once the decision has been made to leave the Impella in place and transfer the patient to the intensive care unit, please use the following steps. Flush the sidearm of the repositioning sheath located on the catheter shaft. Place a dead end cap on the sidearm of the repositioning sheath to prevent further usage. Apply light manual pressure just above the puncture site. Remove the peel-away introducer completely from the artery and skin, drawing it over the catheter shaft and applying more pressure to maintain hemostasis. Grasp the two wings and bend forward until the valve assembly comes apart. Continue to peel the two wings until the introducer is completely separated from the catheter shaft. Slide the repositioning sheath over the catheter shaft and advance it into the artery to the blue suture pads or until hemostasis is achieved. Secure the repositioning unit to the patient by suturing the blue suture pads to the skin or by applying a stat lock stabilization device. Attach the anti-contamination sleeve to the blue section of the repositioning sheath. Lock the anchoring ring in place by turning it clockwise. Secure the catheter shaft in place by tightening the connected anchoring ring. Carefully extend the anti-contamination sleeve to maximum length and secure the end closest to the red Impella plug by tightening the anchoring ring. This completes the demonstration of the insertion procedure for the Impella 2.5 and Impella CP catheters with the automated Impella controller.